Hi, this is Taylor. I'm here to do my newborn assessment. So I will go ahead and knock on the door and introduce myself. Hi, my name is Taylor. I'm going to be one of the student nurses with you today. I'm going to be here to do a newborn assessment. Is that going to be okay? To the mother. The mother will go ahead and say yes. I'll go ahead and compare her, I'll ask her name and date of birth and compare her wristband to baby's wristband here. And I will always have to unwrap the baby to verify the wristband to make sure I have the right patient with the right mother. So then I will go ahead and, first I notice that the baby is sleeping in the crib. So there is a safe environment, no soft items, and I will go ahead and perform hand hygiene and don some gloves. Since the baby is sleeping, it does not appear that he is in any distress or pain. I can see that his skin is pink, and I'll go ahead and start with the assessment. My first thing that I'm going to do is I'm going to actually listen to heart, lung, and abdomen sounds. So I'm going to go ahead and unwrap baby real quick. I'll go ahead and use the bell of my stethoscope. So aortic, pulmonic, Erb's point, tricuspid, and mitral. And I will stay here for a full minute to make sure that the baby's heart rate is in regular rate and rhythm. Usually the heart rate will be anywhere from 100 to 160. Since the baby is sleeping, it's going to be around 100. So we are regular in rate and rhythm. Next, I will go ahead and listen to lung sounds. And the best place for it to listen will be the sides. And this is also where I would like to stay for a full minute. Baby's respirations can be a little irregular and shallow for newborns. And perfect. So normally a baby's respirations are anywhere from 40 to 60. So we're at 40 and we're within normal limits. I'm going to go ahead and listen to abdominal sounds. So I'll start in the right lower quadrant, right upper, left upper, and left lower. Within 15 minutes of birth, there should be bowel sounds present. So we are good there. And I'm going to actually go ahead and just kind of cover him a little bit. I'm going to go ahead and assess the head. So I will take off the cap and run my hand in the back here, just being mindful of the suture lines and the fontanelles. The fontanelles should be a little soft, just a little sunken in, and the suture lines I should be able to feel. If there's just a small overlap, that is okay. It is within normal limits. So I'm going to go ahead and also measure with the tape measure that I have. I will go ahead and do circumference. So that'll be right above the eyes, and I'll make sure that it's taut so I have an accurate length. Then I will go ahead and check chest circumference, which will be right at the nipple line. That should actually be about 2 centimeters less than the head. Then I will go ahead and do the abdomen as well, and it's going to be below the umbilical cord. I will measure that, and then I will go ahead and measure from the crown of the head and actually extend the leg out so that I have a full length to get the length of the infant. And let's see here. And then I'm going to go ahead and do my pen light. So I'm going to look in the baby's eyes. So pupils are, the iris is brown, sclera is white. Go ahead and do a little flash there and a little flash there. And the pupils are reactive to light. So everything there is normal. And then I'm going to go ahead and check the ears. I do have 2 ears on this newborn, and it should line up right with the eye. So we are within normal limits there. And then I will go ahead and inspect the nose. We're going to occlude 1 nostril and then 1 nostril here. And both nostrils are patent, so there are no abnormalities there. I'm going to go ahead and inspect the mouth. So everything looks fine for the oral cavity. I'm going to go ahead and get a little yawn from my sleeping baby. So the lips, oral mucosa, and the tongue are moist, pink, appropriate color. There's no evidence of cyanosis. I have my gloved hand. I'm going to go ahead and put my finger in the mouth and feel for that top of the palate to make sure that it is intact. And then I'm also going to see if the baby is ever going to start sucking on my finger to verify that the sucking reflex is present. So baby does. So next I'm going to go ahead and move on to the rooting reflex. I'm going to go ahead and brush the baby's cheek, and the baby should actually turn to the side of stimulation. So that is also intact. And then I'm going to move down. So we have the neck. And I'm checking for webbing or any vernix or anything like that, and range of motion. So infant is able to move the neck, and we have no issues with webbing there. And then I'm going to check the clavicles, which are intact and normal. And then I'm going to move to the chest. So I do see that he does have a bump in the center, which is the xiphoid process. I'm going to let the parents know that this is very normal, and this is a normal variation. So then I'm going to move down. There are 2 nipples that are free of discharge with no abnormalities. We're going to go ahead and check out the arms, flexing and extending equally, and there's good muscle tone. I'm going to go ahead and check the brachial pulses, and these should both be equal, and they are. I'm going to go ahead and move to the hands, and I'm going to count each finger, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I'm going to go ahead and place my finger in their hands to check the palmar reflex, and they should curl their fingers over mine. And then I am going to keep moving down to the stomach. So the stomach is soft, it's round, protruding a little bit. That's normal. I want to inspect the cord. So there's no redness, no swelling, the area is dry, and the clamp is tightly in place. I'm going to go ahead and look at the lower extremities. Baby's able to move both legs, able to abduct and adduct both hips, bends the knees. So those are all good signs, and we are within normal limits with good muscle tone. I'm going to go ahead and check the femoral pulse. We're good there. And I'm also going to check the legs to make sure they're both equal in length. And they are. So that is good. Then I'm going to go ahead and check the feet and the toes, and we're going to count them out. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I'm still going to assess for that. Now it's going to be the plantar grafts. So I'll put my finger against the toes, and the toes should be able to curl around mine. Also, I'm going to go ahead and check for the Babinski sign, and I'm going to actually stroke the heels. Stroke the heel, and then the toes will actually flare out when the heels are stroked. And so the Babinski sign is also within normal limits. I'm going to go ahead and check the genitalia. So I will go ahead and remove the diaper. Let's say we had a little boy, which I've been calling him a little boy. So we would see, we would have the penis and make sure that the meatus is at the tip of the penis. If it was not, then we would have issues with circumcision. That might not be an option for the parents that we would have to discuss. So the meatus at the tip of the penis is within normal limits, and we're going to go ahead and go in the scrotal sac, and we actually have to feel both of the testes, that they are descended. So that is good, and they feel small, round, and movable between our fingers. If this were a female, if it were a baby girl, we would go ahead and note that there are that the labia minora and the labia majora are present. It might be a little swollen from after birth and just a little darker, and the clitoris will be covered. We might see some edema and white mucus and just maybe some blood, just a small amount, which is normal for a female because of the mother's hormones. I'll go ahead and let the patients know that, we'll let the parents know that urination usually is within the first 12 to 24 hours. It might be just a little darker because the urine is concentrated, and we should look for that meconium, which is the first bowel movement, in the first 24 to 48 hours, and it's a greenish black sticky. And then I'm going to go ahead and turn the baby over and check out the spine curvature and palpate the vertebra there. So that is within normal limits. I'm also going to look at the sacral area. This will not be here. There will be, I'm checking for any dimpling, any hair, and of course any Mongolian spots. And I would let them know about that, which we don't see any of them, so that is good, even though Mongolian spots are normal. But, and then we'll go ahead and check out the anus and see that the sphincter is intact and it's closed, so that is good. Go ahead and put the baby back down. And the last but not least, we'll take the baby's temperature, and this will be my thermometer. I'm going to put it inside the axilla, like so, and hold for the baby to take the temperature. That way I know that the thermometer probe is inside the axilla and won't be, sticking out or anything like that. And then I'll go ahead and get the temperature. We are at 98, which is in range. We should expect anywhere from 97.7 to 98.9. Put the baby's diaper back on, and I'm going to go ahead and swaddle the baby back up. And just let the mother know that I'm actually done with the assessment. If there's anything else that they need from me at this time, and that the doctor will see them, and to let us know if you need anything. I gave the mother the call light, and the baby is back in the crib with a safe environment and no soft items present with him. So we are all set. I will perform hand hygiene, and I am done.